be grateful and thank Dr. Santosh Rao, the president of SIO, for his interest in Ayurveda and for his support in hosting this webinar. Thank you all. And without further ado, I would like to introduce Dr. Kripali Desai, who is an Ayurvedic physician and researcher, and she is a moderator of this group and played a tremendous role in bringing together this webinar for all of us. Kripali, the session is yours.
Thank you so much, Dr. Santoshi. Thank you. It's an absolute pleasure to be moderating today's session. If you have any questions for the panelist, please put it in the Q&A section, and we'll try to address it at the end of the webinar. Without any further delay, we would like to start the webinar, and I would like to invite our first speaker, Dr. Ram Manohar. Dr. Ram Manohar has an MD in Ayurveda and is currently serving as a research director at the Amrita School of Ayurveda, India. Dr. Ram Manohar, you can share your screen.
Thank you, Dr. Kripali. Hello to everyone and greetings from India. A great pleasure in presenting a brief overview of Ayurveda and its status in cancer care in India. India has a pluralistic healthcare system, and apart from biomedicine, we have other systems legally recognized like Ayurveda, Yoga, Naturopathy, Unani, Siddha, Swarikpa, and Homeopathy. And all of these come under the umbrella of traditional complementary and alternative medicine, but in India, they are known as the Ayush systems, and we have a separate ministry of Ayush that regulates the practice of these traditional medical systems. So the Indian situation is that we have coexistence of different medical systems, legally recognized, but practitioners work in silos. So integrative medicine in India is still in the very early stages of development, but there are some encouraging initiatives happening. For example, the ICMR, the Indian Council for Medical Research, and the Ministry of Ayush have joined hands to promote research that can facilitate the development of integrative medicine in India. And as part of the research collaboration, many modern medical institutions have departments of Ayush, like, for example, the All India Institute of Medical Sciences, the Institutes of National Importance in India, JIPMER, which is also a very leading medical institute in Puthiyedath. They are all going to be upgraded into departments of integrative medicine. So in this scenario, integrative oncology is also in its infancy in India. We have a situation where cancer patients do seek care from Ayush practitioners for various reasons. Sometimes it's fear of conventional treatment. Sometimes it's with the hope of minimizing side effects of, cancer therapy. Sometimes for add-on benefits or to improve quality of life, or sometimes even with the hope of, benefiting with a magical cure. It looks like amongst the Ayush systems, Ayurveda, which is the indigenous healthcare system in India, is one of the most predominantly used by cancer patients presenting with different types of cancers in varied stages of disease progression. So we have a very complex situation. These interventions are administered sometimes as standalone therapy, sometimes as adjuvant medications. And we see a whole spectrum of approaches on how Ayush and especially Ayurveda is integrated with, cancer treatments. Now, there is a strong opinion, like, for example, to quote Sanjay Kumar Paul, who's a gastroenterologist, he points out that 50% of the world's cancer burden is carried by developing countries which have access to only 5% of the resources available to fight the disease. And in these circumstances, systems like Ayush, traditional complementary and alternative medicine, as it is called in India, may become an important component of modern oncology if integrated properly into mainstream medicine. Looking at the prevalence of the use of Ayush systems for cancer in India, we do not have sufficient data. There are some scattered studies which report the prevalence of use of Ayush in cancer care. And these studies give, varied data on the actual prevalence of use. For example, one study found the prevalence of Ayush usage to be around 23.35%. Some other study points out that it is 34.3%. In yet other study, the overall TCAM use was found to be 38.7%. We did a study at the Amrita Institute of Medical Sciences, and we found that 34.4% of the patients were actually using, Ayush systems. One study has reported that the most common traditional complementary alternative medicine used in India for cancer care was Ayurvedic treatment out of the Ayush systems. And that is what makes our initiatives also very interesting. Ayurveda seems to be leading the scenario of integrating traditional medicine with cancer care. There are also very interesting observations, like, for example, 60% of patients who are aware of Ayush were not using traditional complementary alternatives, but still about 40% are using Ayush systems. It is necessary that we do more widespread surveys because these scattered studies are sometimes giving contradictory, findings. In our study, which we did at Amrita Institute of Medical Sciences, we also found that a significant number of people were also resorting to home remedies. This means that people were self-medicating and they were not consulting any practitioners when they were integrating alternative systems of medicine. Another area of concern is the underreporting of practices. Lack of information regarding drug-herb interactions and rigorous reporting of treatment outcomes. This is something which keeps oncologists and decision makers skeptical. And that is why integrative oncology is not really developing in a formal way. There's a lot of concern about how Ayush systems are integrated with cancer care. It's mostly patient-driven integration. And so oncologists are really very concerned about what will happen when such medications are taken along with chemotherapy or radiation. And one study reported that nearly 68.75% of the users were simultaneously receiving conventional anti-cancer therapy. And these are not reported to the oncologist. So there is a strong likelihood that this might lead to situations where drug-herb interactions that are causing undesirable outcomes may go unnoticed. Also, the benefits of integration of Ayush may go unnoticed if these practices are not properly reported. Certain surveys have revealed that half of the patients who received some form of Ayush intervention, especially Ayurveda, they report having experienced symptomatic benefits from use. So while there is the fear of unwanted effects, there is also, reporting of benefits. In this regard, the Central Council for Research in Ayurvedic Sciences, which is a Ministry of Ayush organization, has initiated a very interesting documentation program, which is called Ayurveda Interventions for Cancer, Systematic Review, Meta-Analysis and Revival, Documentation, Validation and Analysis of Data from Practitioners. And it is hoped that as the results are published through this initiative, we'll have a better understanding of what is happening at the point of care. Another major initiative for integrative oncology in India, this is a very new, development, is that the Tata Memorial Hospital, which is one of the most prestigious cancer hospitals in India, is all set to develop an Ayurveda-based cancer hospital for integrative oncology. I think this is a milestone development, and this is supported with a huge funding of 300 crore Indian rupees by the Department of Atomic Energy. So an oncosurgeon, for example, comments on this initiative in a very positive manner, saying that it will bring much needed scientific-based evidence, and this center hopes to conduct clinical trials and collect scientific data and ensure that there is more evidence-based and systematic integration of Ayush systems with modern cancer care. This hospital has been initiated and set up, in the words of the people behind this initiative, to address problems like patients trying many things and many unlicensed practitioners also, offering care for patients without proper evidence and a systematic approach. Now, I'd like to, the remaining few minutes, give a snapshot of what is really happening in India. There are many ways in which, Ayush systems are being offered to cancer patients. Here is an example of an integrated cancer treatment and research center in Pune, where Ayurveda physicians who are specializing in cancer care and modern oncologists are working together to offer integrated care for cancer patients. So this is a very unique experiment in integrating modern oncological interventions in an Ayurvedic setting. There are also completely independent Ayurvedic centers for cancer care, and here is an example of the Raja Ramdev Anandilal Podar Central Ayurveda Research Institute for Cancer in Mumbai, which is run by the Central Council for Research in Ayurvedic Sciences, Ministry of Ayush. And as I was mentioning, the Tata Memorial Center, initially it was like an Ayurvedic center in an oncology department. Now they're expanding into an independent Ayurvedic hospital. We have also very interesting situations like a modern oncologist, like Dr. C.P. Matthew is the first medical oncologist in Kerala. When he encountered his own patients getting benefits from Ayurveda and Siddha systems, he started integrating these treatments into cancer care. And we have a whole legacy of about 40 years of his experience with the Central Council for Research in Ayurvedic Sciences is now in the process of documenting. There are many individual practitioners. I just wanted to show that they are found all over India. I'm not going into the detail for want of time, but we also have individual practitioners, integrating Ayurveda into cancer care. So to conclude, what is really needed at this moment in India to really bring integrative oncology to the forefront is that we need to generate evidence of the benefits of Ayurvedic interventions, because one advantage in India is that a lot of things are actually happening at the ground level. So documentation itself can reveal a lot of interesting things that Ayurveda and Ayush systems can do. Well-conducted studies targeting independent practitioners, researchers, and institutions. Another important thing is conducting herb-drug interaction studies, chemosensitivity studies, based on both laboratory research and real-time clinical observations. And in the background of this kind of research and data generation, we would be able to develop evidence-based guidelines for integrative oncology. So that's a snapshot of what's happening in the field of integrative oncology in India. Thank you for your patient listening. Namaste.
Thank you for your excellent presentation, Dr. Ram Manohar. That was very nice. I would like to invite our next speaker, Dr. Eran Ben. Dr. Ben is a clinical professor presently serving as the chairman, Department of Family Medicine, in the Rappaport Faculty of Medicine, Technion Israel Institute of Technology, Israel. Dr. Ben.
Thank you very much, Krupali. And shifting from the excellent introduction of Rammanohar, I would like to have a glance in Europe and the Middle East to see the impact of Ayurveda and maybe the potential of collaboration between those regions across Asia. And I would start with some geographics and history, because the birth of the Western civilization is usually located here between the Egyptian school of medicine and the Mesopotamian one, including Iran, including the area here of Cyprus and Greece, as you well know, and the birth of monotheistic religions with a specific relation to medicine, and actually to fields like homeopathy that were born here thousands of years ago. So when you look at the Hippocrates Greek medicine, the birth of Western medicine, and you see the other two kingdoms of medicine in China and in India, with the Charaka school of Ayurveda and the Sushruta school of surgery, you could see that actually Islamic medicine or Arab medicine were the ones that transmitted the Ayurvedic and the Chinese remedies and philosophies to Greece and vice versa. And actually this area of the Middle East and let's say Eastern Europe is the place where all those methodologies were merged. So we are talking even today about cross-cultural medicine, about traditional medicine that is weaved in the unconscious background of our patients. And we experience cross-cultural barriers and opportunities in the interaction all over. So when we talk about the possibilities of integration of Ayurvedic medicine as part of integrative oncology, I would suggest to observe these concepts of health belief models, of patient-centeredness, of treatment-tailored paradigms, and actually the paradigm shift from dichotomy of traditional medicine and conventional medicine to integration. And that's, I think, the challenge that we all face, and Rammanohar described it beautifully as something that is really experienced in India in the interaction between Ayurveda and conventional oncology. So actually in our region, in the Middle East, Ayurvedic herbs are weaved into ordinary life. We use what we can call masala in our tea, in our food. This is curcum that is grown in my own garden, a few meters from here. And that's ashwagandha that I grow as well. So basically, it's an area which is on the continuum between India and Europe. And when we look at our patients, the use of herbal medicine, just like in India, is really with high prevalence. Above 50% of our patients use herbs during chemotherapy and the active oncology treatment. And when we surveyed 16 countries across the Middle East, we have found that it's not just about efficacy, it's a lot about safety and risks. And that's a summary article published in Cancer a few years ago about the safety concerns and the need to integrate or to invite integrative physicians to each of the oncology centers where patients are treated with high affinity to traditional medicine. And actually, that's what should be achieved in India as well. So typically, when we see patients in Europe and in the Middle East, I'm coming from Israel, as you well know, when we see patients like these Muslim patients aged 36 years old with metastatic breast cancer, the idea when the oncologist, nurse oncologist, or psycho-oncologist refer that patients to the integrative oncology program is to try and weave a patient-tailored treatment based on the biopsychosocial, spiritual elements, which are so nicely characterized in Ayurveda. So the patient's narrative and concerns lead to a patient-tailored treatment, and the integrative medicine mediates between conventional medicine and patients' health belief models. And these three main modalities that I mentioned are really important when you consider integration of Ayurveda within integrative oncology practices in Europe and the Middle East. So it's about herbs and nutrition, it's about mind, body, spirit, and it's about touch therapies. All those three modalities are so importantly used and characterized in Ayurvedic medicine. What is really amazing is to see the similarities between different schools of integrative oncology modalities and to see how relevant it is to understand better traditional Chinese medicine or anthroposophic medicine in Europe by observing, contemplating Ayurvedic medicine. And this is a study we have published with the guided imagery concepts based on Chinese medicine, Ayurvedic medicine, and anthroposophic medicine with the goal to relieve xerostomia induced by chemotherapy or radiation. So mind-body medicine is based on so many schools of Ayurvedic medicine and Tibetan medicine, as you well know, and comparing the different modalities, the Western ones and the TCM ones, by the use of Ayurvedic medicine is highly helpful, even if you want to build up, to design, to co-design with the patient and the caregiver a nutritional strategy. And that's a suggestion how to do that. That was published in that textbook of nutrition and the cancer patient. So it's about the merging of these concepts, not just as supplements, which are highly used in the United States, for example, but here in Europe and in the Middle East, we like more than using, drug herb supplements. And we use it in the kitchen, in the cuisine, and that's something where you can really weave and combine and introduce Ayurvedic concepts and Ayurvedic foods using the Vata, Pitta, Kapha, and the 6 states and the 5 elements, which are basically very similar to the Greek ones with the addition of the ether. So it's quite easy to translate the Ayurvedic concepts into westernized integrative oncology practice. And here you can see pictures from cuisine workshops that we do. And we use actually ingredients with references to traditional medicine, in this case, Islamic and Jewish medicine references. But you see that the herbs are quite Ayurvedic, like turmeric or cinnamon or ginger. So when we established the merger, the Middle East Research Group in Integrative Oncology, our intention was to integrate integrative oncology in the West and Ayurvedic medicine in the East. And I think that it's really achievable. It's highly relevant today in Europe with cross-cultural and cross-sensitive aspects that we deal, especially when we were challenged by the refugee crisis from the Middle East to Europe. We collaborate with different institutions all over Europe and the Middle East. And one of the main aspects that is important for the next phase of collaboration is with medical education, training workshops like the ones that we do in Europe and the Middle East. And I believe that these ones can integrate Ayurvedic medicine. This is an example of the module that we have developed in the MOOC session about traditional Ayurvedic medicine, which is open to the public, and actually that could be used in medical education initiatives. So when you look at different schools of Ayurveda in Europe, you would see many publications and initiatives, especially in Italy, Germany, and the UK. But when you go into Medline, into PubMed, you see very few RCTs, randomized controlled trials, published on Ayurveda. For example, 14 from Germany, 8 from the UK, 5 in Italy. And when you add cancer to what you're looking for, you would see limited evidence, limited number of RCTs. Actually, one that I have found here, where European researchers collaborate with Ayurvedic researchers about cancer. So we have a long way to go into when we combine traditional medicine, Ayurvedic traditional medicine, and the more modern integrative oncology, where Ayurveda is actually part of this integrative process. Thank you very much.
Thank you so much for a wonderful presentation. It was so interesting to know the status of Ayurveda in Middle Eastern countries and Europe and the ways to integrate Ayurveda in other countries. Thank you so much. I'm going to invite next speaker. We have two speakers, Dr. Jeffrey White and Dr. Julia Arnold. Dr. White is Associate Director, Office of Cancer, Complementary and Alternative Medicine, National Cancer Institute. And Dr. Arnold serves as a special volunteer at the National Cancer Institute, Office of Cancer, Complementary and Alternative Medicine.
Okay, you can see my screen okay?
Yes.
Great. So thank you so much for this opportunity to speak to the SIO about Ayurveda and all others that have joined us. So Dr. White and I are working at the NCI Office of Cancer Complementary Alternative Medicine, and we wanted to give you an overview about what kind of grants have been given in Ayurveda over the past, and then Dr. White will talk about some future activities. Stand by. Okay, so this slide presents results from analyzing the NIH grant portfolio related to Ayurveda. The various searches targeted different grants with terms Ayurveda or Ayurvedic that's listed, and it would include all disease states, not just cancer. So some of these results might have grants that have just referenced Ayurveda, but maybe not focused on it. So the graph on the left shows how many grantees were awarded, which were 18%, compared to unfunded, 82% over the last 10 years. And this is about the normal range of success rates for grants. So these analyses both include about 163 applications of awarded grants. The graph on the right, and most of the next slides that I'm going to present are coming from a research, iSearch, which is a unique search program that's internal to the NIH, and it captures all of the grants and the topics and conditions and details of the grants. And this particular search went all the way back to 2000. And this chart shows all of the institutes that are supporting Ayurveda research, and the majority is for the National Center for Complementary and Integrative Medicine, followed by NCI, Research Resources, and TW is the Fogarty Group and other institutes. So we look here to see how many grants were awarded each year. Again, about 160 grants total. And the peak was somewhere in 2012 to 2017. Some of these are the same grant repeated multiple years. So, and since then, the number of grants have diminished. The particular award mechanisms of the grants are mostly the R21s. These are the exploratory grants. Those are followed by the research program grants, the RO1s, research progress grants, and then mentoring grants, the K grants, the fellowship grants, and cooperative agreements. An interesting part of the iSearch program allows visualization of what we call research condition and disease categorization. So it takes all the grants and it looks at the topics that are related to what that grant is working on, and it sorts them out. And here it shows you a relative amount of how many times that particular topic came up in how many grants. So we see that cancer is a very common topic of the awarded grants in Ayurveda, cancer cells, breast cancer. And within each of these sections, you can actually blow that up to see more specifics about what active compounds were being used. And this one is using compounds in Alzheimer's or cognitive impairment. These are things like Centella asiatica or Goticola. Withania somniferus is the ashwagandha component. We see that over here in the cancer topic. So we see curcumin being researched, a lot of curcumin. And then if you look at this one is the breast cancer group, this is more related to survivorship and natural products. So it's a really neat way to go through and see how many grants are in what areas. Another way to visualize the most common focus of Ayurveda research is the categories this way. And we see that CAM is obviously one of the top areas of research, followed by nutrition, aging, prevention, cancer, etc. So in this slide, we see data from the PubMed, which is a list of all the publications and ever, and it shows a number of publications on Ayurveda per year from authors in the US. So the grants that come from NIH is just blue line, and it shows these are specifically publications that came out of NIH grants. And then the orange line is publications that came out of grants that were not funded by NIH, and the gray is the total. And so what we see is that sometimes the publications have increased over time, but the NIH grants, the publications have decreased, and that might reflect the fact that there's less support there. But the interesting thing is that research continues, and a lot of times these other grants are supported by maybe their local institution or foundational support, but they did not list any research or no support at all. Often they just do it themselves. So finally, out of all of the grant and publication activity, there's still very few published clinical trials. This is certainly not an exhaustive list, it's just the highlights. There's even few in cancer, and Dr. Dhruva hopefully will be talking about his work next. But then there's others that do show the mechanisms of how to do that clinical trial research, and this was other areas of rheumatoid arthritis or diabetic neuropathy. And the bottom line is that we do need more examples of efficacy and clinical applications of Ayurveda. In this way, we can encourage more funding for Ayurveda research. And so now Dr. White will describe some of the activities here at the NCI OCAM.
Yes, thanks, Julia. So I want to take the next few minutes to give you a little more specifics about what we're doing at the National Cancer Institute. And as many of you know, so we're part of the National Institutes of Health. We're the NCI is the largest of the 27 institutes and centers of the National Institutes of Health, and we're the major organization within the government that focuses on cancer research across the spectrum, from cancer causes, prevention, detection, diagnosis, and so on. Next slide, Julia. So specifically with regard to traditional medicine or research that relates to traditional medicine, I'll give you some examples of what's in the NCI portfolio. So you see here some preclinical and clinical research studies that just give you the titles and the information about where they're being done and who's the investigator. I just want to point out that so the portfolio is heavily focused on either components of herbs or such as the green tea polyphenols or beta-glucan, the last two there, or herbs themselves like Scutellariae bicalensis, or in rare situations, an entire herbal mixture like the top one, and the second one, which is looking at these are multi-herb mixtures. And the second one, particularly interesting since it's looking at actually includes a clinical trial. Let's go to the next slide. Curcumin, as was mentioned by Julia in the earlier slide, so a lot of research relates, as this is more clinical research here, relates largely to symptom management. As you can see here, you get some sense of that. It includes also yoga, pranayama from traditional Indian approaches. Let's go to the next one. So at the NCI, what my office in particular, what we've tried to do is to build some collaborative relationships to explore natural products that come from traditional medical systems. This is just lists some of the mechanisms through which we do this, these memoranda of understanding or material transfer agreements. Basically what they allow is the transfer of IP protected information, and including products from these institutions, and the exploration of them for various purposes, particularly for direct anti-cancer activity, and sometimes for mechanistic assessments. And so we've been successful at building these relationships this all started out of with China, and this is something we also hope to do with other countries, and particularly with India. The NCI 60 that's mentioned there is 60 cell line screen is the major screening process that's used to explore these anti-cancer activity of any compound. Next slide. We've also assisted in having postdocs come over from, this has been from China. These are people who train in traditional Chinese medicine. They have their degrees there. They generally also have a PhD. They come and work in NCI laboratories of various kinds, and this just shows some of the ones that have visited us. And they generally spend between, generally about 2 years in the lab. COVID obviously interrupted a lot of that. And these are some of the publications that has come from them. Next slide. Yes, in India. So now moving to India, dates now are, we've been building more relationships with the Ministry of Ayush since 2016. And this was a major conference that we did with them, and that has set up a lot of the following on activities. Next slide. So if you go to our website, and there's the URL up there, you can learn a lot more about what we've been doing. And go on to the next slide. One of the main things that we have done is a webinar with the Central Council for Research in Ayurvedic Sciences. That's the CCRAS. They're a component of Ayush, the Ministry of Ayush that Dr. Rammanohar mentioned. And so we've done some webinars with them in which we basically just exchange information about what each of us are doing or supporting on topics related to cancer and integrative medicine. Next slide. All right, the major activity that we're doing right now is a survey of Ayurvedic professionals in the United States, or who have been who see or have been in relationships with patients in the United States, cancer patients largely is what we're interested in. And the goal here is to gather enough information, the kind of information that might raise awareness about the existence of these professionals, what they are doing with regard to cancer patients, what's their interest in how they communicate with other healthcare practitioners, what's their interest in research, what's their background, and so on. And so next slide. So we put together a team of investigators to work on this. You see the 4 members from the NCI, including myself and Dr. Arnold. And then we have Baswati Bhattacharya, who's a member of the SIO group as well, and Anupama Kizikivitil, as you see there, Anand Dhruva, who will be speaking next, I believe, Manohar Gundetti, who's with CCRAS, Gabe Lopez from MD Anderson, and Frank Nanavaji from Yale. Next slide. So how do we connect to these professionals? Well, they're not the major group that we deal with on a regular basis. So we've made relationships with many Ayurvedic organizations throughout the United States. There are many of which are listed here. I highlight the National Ayurvedic Medical Association because of their scope and their tremendous assistance that they've been able to provide us. Next slide. And this is, if any one of you is an Ayurvedic professional who would like to participate in our survey, there's a link there for you, and we look forward to culminating this information and reporting it sometime soon. That's my last slide. This is the last slide with our contact information. All right, so thank you for your attention.
Thank you so much, Dr. White and Dr. Arnold. Our next presenters, Dr. Anand Dhruva and Dr. Santhosshi Narayanan. Dr. Dhruva is a professor of medicine in the Division of Hematology Oncology at the University of California, San Francisco School of Medicine. And Dr. Narayanan is a clinical associate professor of integrative medicine at the University of Texas, MD Anderson Cancer Center.
Thank you, Krupali, and thank you to the organizers for inviting me to speak today on Ayurveda care models and oncology in the US. As Krupali mentioned, I'm a researcher and clinician with training in Ayurveda, And today I'll share my clinical experiences incorporating Ayurveda into my integrative oncology practice at UCSF. So by the end of this short talk, you'll be able to do the following 3 things: describe clinical care models for integrating Ayurveda in the US, including individual and shared medical visits, describe clinical considerations for integrating Ayurveda approaches during and after cancer treatment, and describe the value of an Ayurvedic approach for cancer survivors. So this slide really just frames the key clinical considerations for me in my practice in integrative oncology, integrative Ayurveda in oncology. And really, the primary approach is a whole systems approach. And what this means is that I like to express the whole system of Ayurveda in the clinical work. So that includes the theoretical framework of Ayurveda, the diagnostic and multimodality therapeutics. That's really sort of a critical aspect of how Ayurveda is incorporated here in this work. Another important consideration from an oncological perspective is the phase of treatment and unique considerations that are there. So for example, during treatment, cancer patients, there may be some limits as to extent to which they may be able to incorporate Ayurveda, especially if it's new to them. And additionally, there may be limitations in terms of herb-drug interactions. And so the approach is unique there versus during a survivorship phase where there may be more expansive opportunities available for patients in that stage. And then lastly, the Ayurvedic integrative Ayurvedic care can be delivered in either individual visits in a clinical setting or in what are called shared medical visits, where a group of patients come together to receive the care in a shared medical visit setting. And I'll give you brief examples of both of those. So first, just an example from my individual clinic that speaks to the potential value of Ayurveda in oncology care. And this post-treatment patient presented with fatigue after about 6 months after completing treatment for a local recurrence of breast cancer. And you see some of the details provided on the slide. Originally, it was a stage 1 diagnosis, hormone receptor positive, HER2 negative, and you see the treatment there. 4 years later, there was a local recurrence of the same kind of cancer. Again, in the evaluation of fatigue, there were no revealing findings in terms of laboratory studies. And the final biomedical diagnosis was fatigue in a patient with a history of cancer. So again, a non-specific diagnosis. So what if we take a look at this from an Ayurvedic perspective? So one of the things that we do in Ayurvedic assessment is look at pulse, tongue, and other parameters. And so this patient described, again, several weeks of fatigue, indigestion, mouth ulcers, and other digestive issues. And so you can see the tongue evaluation here, which shows a yellow coating in the back of the tongue, some prominent redness and ulcerations there, and also a deep central crack. So that gives you a sense of some additional information that you can gather from an Ayurvedic evaluation that you wouldn't get from a purely biomedical one. So this leads to the final Ayurvedic diagnosis for this patient, which is shown on the slide. You can make a constitution diagnosis, which in this case is Pitta Vata, an imbalance diagnosis, which is an imbalance of those 2 doshas, and also specifically looking at digestion, metabolism, and what are called in Ayurveda digestive toxins, which are all imbalanced in an issue in this patient. So this more expansive, more actionable Ayurvedic diagnosis gives more opportunities for therapeutic potential for this patient as well. And so based on that, I recommended a treatment approach to address the digestion and imbalances that I mentioned on the earlier slide, and listed some of the specific treatments that were recommended to this patient. So a light, easy to digest diet, focusing on balancing Vata Pitta, some simple herbal medicines like Triphala and digestives, exercise, and meditation prior to meals. And so with this brief sort of focused treatment plan, you can see that after 4 months of treatment, the patient reported improvement in symptoms of fatigue, more energy, better digestion, and you can see the contrast in the tongue exam before on the left and after on the right. So again, this gives you a sense of how if you take only a biomedical pathway for this situation of cancer survivorship issues, you have clinical evaluation, laboratory test, imaging, you'll come up with a biomedical diagnosis, which in this case, again, is a non-specific diagnosis of fatigue. Perhaps there are some limited treatment options, but again, overall, very limited framework here for how to approach a patient with these kinds of issues. Adding on the Ayurvedic lens to this patient, You have the full Ayurvedic assessment at your disposal, broader clinical evaluation, including tongue and pulse assessment, which I showed you. It gives you a more expansive Ayurvedic diagnosis and more expansive treatment options. And at least in this case that I showed you, an improved symptoms and a good outcome, at least for this particular patient. So that gives you an example, again, of how Ayurveda can be incorporated in an oncology setting, especially to address survivorship concerns, symptoms, and quality of life. I want to share with you also another care model that I incorporate in my practice at UCSF, which is Ayurvedic cancer survivorship shared medical visits. And again, as I mentioned, this is an 8-week series that we do with cancer patients, about 10 patients in the series. And we go over the objectives that are described here: discover mind-body constitution, create and implement an Ayurvedic nutrition plan, lifestyle plan, and also go over yoga breathing practices in this 8-week shared medical visit series. So again, just a slight contrast to the individual work that can be done with patients using Ayurvedic approaches. They're also shared medical visit approaches. And lastly, if this session today has piqued your interest in Ayurvedic training, we offer an integrative Ayurvedic medicine training at UCSF for clinicians at the UCSF Osher Center. And I've listed the web link here if that's of interest to anybody here today. So in conclusion, I described to you today some care models for integrative Ayurveda using individual and shared visits, and also gave you an example of how this can be incorporated in clinical practice. And again, glad to answer questions later at the end. So thank you for your attention.
Thank you, Dr. Dhruv. Dr. Santhosshi.
Thank you, Kripali. Thank you, Dr. Dhruv. That was an excellent presentation. I'm going to share my screen. Are you able to see my screen, Kripali?
Yes. Yes.
Thank you. So thank you all for joining us today. So I'm going to discuss integrating Ayurvedic medicine with conventional cancer therapy and a care model for doing this. And I'm going to use examples of what we do at MD Anderson Cancer Center in my practice of integrative oncology. So first of all, I would like to define what is integrative oncology. I see that there's a lot of people from the audience who are already practicing integrative oncology, and there are several Ayurvedic physicians who joined and other providers as well. So integrative oncology is a patient-centered, evidence-informed field of care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer therapies. And as you can see that Ayurveda also has similar approaches such as natural products, mind-body practices, and lifestyle modification that is emphasized. In terms of how do we approach the patients and how can we care for these patients in a setting where we have the traditional medicine such as Ayurveda and we have the regular or conventional cancer therapies, what can we do for the patient? Because patients wants to know what can they do for their health, which combines the best of both. So in terms of incorporation of integrative medicine into oncology care of patients with cancer, we looked at our care model at MD Anderson and first to understand what is that patients are concerned about and what is the oncology providers want us to do. So what we found was that the patient wants us to talk about diet and nutrition, which is what majority of them want. And second is pain. Third is integrative holistic approach. And we have other concerns such as stress, neuropathy. So in integrative medicine, we discuss several aspects of this, such as physical health, mental health, and social aspects. And we counsel patients on diet, nutrition, pain, and integrative holistic approach. And in Ayurvedic medicine as well, there is an emphasis on diet and nutrition and integrative holistic approach as well. So at MD Anderson, our integrative medicine center model focuses on physical health aspects, which are talking about nutrition, acupuncture, massage therapy. Then we focus on mind-body aspects, which is psychology, yoga, meditation, music therapy, Tai Chi, And also we have social programs, social group programs such as yoga, meditation, and other programs. So how can we integrate? What could be the potential model for integrating Ayurvedic approach to cancer? So Dr. Dhruva has done extensive work on it, and he presented on how he uses his Ayurvedic therapies for his cancer patients. So at MD Anderson, when we see patients, we counsel them as a part of integrative oncology consultation on physical health, emotional health, mind, body, and also we touch on supplements. So I would like to highlight a case that a patient who we recently saw and took care of to see how we can make this happen and what is the potential future models of integrating Ayurvedic care into conventional oncology care for our patients. So we saw a 72-year-old patient gentleman with metastatic cholangiocarcinoma. As we all know, cholangiocarcinoma, which originates from the bile duct, is one of the cancers which has a very poor prognosis. If it is metastatic, patients don't live longer than 6 months to a year. So the conventional oncology recommendations for this patient was chemotherapy, and however, there was not a continuous treatment because this patient had multiple interruptions due to hyperbilirubinemia. And this patient is from India, and the family members wanted to consult Ayurvedic physicians from India, and they consulted Ayurvedic physician I think in Kerala, and the first Ayurvedic physician focused on reduction of ascites that this patient has. So in cholangiocarcinoma and other cancers, patients can develop ascites because of the tumor. But in this scenario, the prescriptions, Ayurvedic prescriptions, were given to the patient, and the focus was to decrease the fluid so that the appetite can be improved and he can have a better quality of life. Then when they took those prescriptions to the conventional oncologist, concerns were expressed because they could not find the database to look up the Ayurvedic formularies, and there was a concern about interactions with chemotherapy, which is a common concern that you all are expressing in your comments, in your questions, in the chat box. So then an integrative oncology referral was made, and this is how a regular practice of integrative oncology, the model works, that oncologists refer patients to our center, Integrative Medicine Center at MD Anderson, when patients bring up discussion on Ayurveda or traditional Chinese herbs or other integrative aspects. So what we did was we actually, I set up a call in which we had Dr. Rammanohar, who is the other co-chair of our Ayurveda Special Interest Group, in the Zoom call, and we had the patient, and I was able to be present during this call to discuss various Ayurvedic approaches and certain Ayurvedic supplements we were not able to look up for potential interactions with chemotherapy. However, he was able to come up with Ayurvedic recommendations which involved dietary approaches, and also we incorporated massage therapy in this patient care. And from integrative oncology approach, we also incorporated acupuncture. So therefore, the patient was able to receive the good care, and it improved his satisfaction. And I would like to highlight a little bit on dietary supplements in cancer care. And this requires a full talk, but in the interest of time, I would like to say that in terms of approach to dietary supplement, which could be applicable to Ayurvedic supplement, we have to first search for reliable websites. And then if we look at the risk, and the risk is minimal versus unknown versus high. And I see Dr. Moshe Frankel joined us too. So we worked together and published this paper recently. And if the risk is minimal, the recommendation is to consider supporting use after verifying the dosage, reliable manufacturers, and interaction. And if the risk is high and the benefit is unknown, the best recommendation would be to suggest avoiding the use of the herbs and supplements for cancer patients. So the other concerns, which is commonly expressed, is the role of antioxidants during cancer care and organ toxicity. So these are some of the considerations. So current application of Ayurveda at this point is in our clinical care is we apply intermittent fasting concepts, time-based feeding. Sometimes I talk to patients about liquid fasting once a week, sleep cycles, massage therapy, mind-body therapies, yoga, and supplements need caution and supervision, and further research is needed. And I would like to also discuss a little bit about Society of Integrative Oncology today. So those of you in the webinar, if you're interested to explore this further through the Ayurveda Special Interest Group and learn more, Society of Integrative Oncology is international with global presence, which has developed several guidelines. And one day I would like to see that there is a guideline for Ayurvedic supplements in cancer care. I think it will happen. It's a matter of time with more research. And Dr. Rammanohar and myself are the co-chairs, so please talk to us. He's also the Indian ambassador. So people from India who are attending today, please talk to him and reach out to him. So the key takeaway from today's talk is integrative medicine involves approaching a patient as a whole, physical, emotional, and social aspects. Ayurvedic herbs and supplements, open communication will help build the physician-patient trust and to direct the patient to the right resources, and collaborative approach of practicing Ayurvedic medicine with conventional or integrative oncology physician, unless you are like Dr. Anand Dhruva, who is integrative oncology physician, regular oncologist, and Ayurvedic physician. This collaboration will help advance the field forward. So I thank you all for being here, and I would like to welcome you all for SIO 2024, and it is happening in the beautiful state of California in October. And we would like to see you all and discuss further about integrative oncology, how we can integrate different aspects of this in our care for our cancer patients across the globe. Thank you all so much. Thank you all for attending. I would like to thank several people. So all the speakers, you all were here with your busy schedule. Thank you all. And all the SIG members, the Ayurveda SIG members, especially Kripali, for putting this webinar together. Thank you, Dr. Kripali. And I thank Dr. Santhosshi Rao, the president of SIO, for letting us have this opportunity, and the whole SIG, it was his idea. And all the people who work behind the scenes, Dr. Eugene and Ms. Jody, and the SIO team, and all the audience for your interest and the questions, and we're here to answer all your questions. Thank you.
Thank you so much, Dr. Santhosshi. And thank you all the speakers for their wonderful presentation. Most of the questions have been answered in the chat. And I think because of the time constraint, the time is already over. Santhosshi, do you want to go over the last question?
I think many of the questions are answered. So I'm trying to see which questions are unanswered.
Yeah, most of the questions have been answered here. So if the attendees have any questions, they can either email the speakers.
So there is a question on, would you be able to provide the presentation for participants after the Zoom visit? And I think Dr. Eugene Ann raised his hands. Eugene, you want to comment?
Yeah, I'll just answer that question. Say the video is recorded, the webinar, and it'll be available on the SIO YouTube channel, probably within 24 to 48 hours. So you'll have access to it all the time.
And I think another question is, can you please make the Q&A available? Is that possible?
I could do that. I can just cut and paste it and put on the website. But yeah, it'll be just, I don't think it'd be worth it. If you have good questions on that are answered, just copy and paste it. That's what I do.
Okay.
And there is a lot of interesting comments, not questions in the chat. So thank you all for that.
All right. Thank you, everyone. Thank you, everyone, for joining. Have a wonderful rest of the day. And good night to some of the participants joining from other countries. Thank you.
Okay.